So testosterone wouldn't be used to necessarily treat erectile dysfunction. That's a whole other separate algorithm where we're
Hmm.
talking about oral medications and vacuum pumps and injections and penile implants. But it's really difficult to get a good erection if one's testosterone level is low.
Hmm.
So, what research suggests is for those who, let's say, were responding well to oral medications, your Viagra, your Cialis, but let's say you're no longer responding or the person is no longer responding and you check their testosterone level and it's low, if you also optimize their hormones, they oftentimes respond better to the erectile dysfunction treatments.
Hmm.
Now, with that, I will say that regardless of what the research suggests, I see plenty of guys in my office who are coming in for a separate reason. Maybe it's a libido issue. Maybe it's a fatigue issue. We check their testosterone level, it's low. I start them on therapy and I ask them during follow up, in what ways do you feel better? And oftentimes their erections also improve, even though I'm not primarily putting them on the medication for their erectile dysfunction. And so they may not even need anything like Viagra or Cialis to treat the ED. So it's really used in combination. And the thought process behind that is just hormones are really important in everybody. And so if you optimize the hormones, you can oftentimes optimize the treatment for sexual function.
Got it. And so, the other treatments you're talking about, pills, injections, pumps, that those are used to overcome the plumbing problem, what I like to call the plumbing problem of blood flow to the penis to get you an erection. But would you say that, and again, this is kind of bantered back and forth, would you say that the testosterone is more in terms of the libido, pure libido, or does it have some physiological effect on erections as well, aside from libido?
There's some physiologic effect as well, because even in those guys, they may or may not report an improvement in their libido, or that may not even be an issue. So we're talking about purely for erectile dysfunction. Now, as well as, any of us who see guys for these concerns, libido is a very tricky topic as well. And if a
Sure.
guy comes in and he can't reliably get an erection, and so his libido is low, like what's the chicken, what's the egg here? And oftentimes, it's hard to tease those two out. So it doesn't necessarily matter. And we really do treat both.